Okay, so this first lecture is going to be of muscles of the head and the face. So we're starting on page 106 of your lab manual. The first muscle is called the occipitofrontalis muscle, also known as the epicranius muscle. So if you follow the cursor, we're looking at this muscle on the forehead. So this is an unusual muscle. It has two bellies, and the bellies are connected by a flat aponeurosis, which is a flat sheet-like tendon. So the first belly we're looking at here in the first box in your list is called the frontal belly of this occipitofrontalis muscle. You can also call this frontalis. So the frontalis muscle, if you look at the position of it, the origin is going to be on this epicranial aponeurosis. So it begins here and it's going to insert onto the skin of your eyebrows. And so you can see by the direction of the fibers when this muscle contracts, it's going to, the origin stays still. The insertion is going to move towards the origin, okay? And so by doing this, it's going to raise your eyebrows. All right, so let's talk about the second belly. If you look at this picture, we're going to follow the epicranial aponeurosis back, and we have another belly of the same muscle. So this area and this area, they're actually technically one muscle. This is the occipital belly of the occipitofrontalis. And so this one has its origin on the occipital bone, so that stays still. Origins always stay still. And the insertion is going to be this epicranial aponeurosis. So now, when this stays still and the fibers get short, right, the action would be to pull the epicranial aponeurosis back or retract it towards the origin, towards the occipital bone. So if you look at your outline, your lab manual, you'll see that the occipital belly acts to retract the scalp. So the action of both of these bellies is to really raise your eyebrows. This one does most of the effort, raises your eyebrows, but this one in the back aids that process by pulling back the epicranial aponeurosis. Okay, so that's your first muscle. The second muscle you see here in the list is called the temporoparietalis, and we can look at it right here. The temporoparietalis is the superficial muscle above your ear, kind of on that temporal and parietal bone, which is why it's called the temporoparietalis. Make a note for yourself that this is the superficial muscle here because it gets confused a lot of times with the deeper one. This deeper one is called the temporalis, and they have different actions. So the temporoparietalis is cut and reflected here. If we go back to this picture, we can see it's also cut and reflected here. So if you look at the lab manual, the origin and insertion is boxed out, so you are not responsible for that. You're only responsible for knowing that it moves the auricle of the ear. So this muscle, it inserts onto the ear, above the ear, the skin, and it would help to wiggle your ear or move the auricle. So the auricle is just this portion of your ear that you can see from the outside. All right, moving on to the muscles of the face. The first muscle in your list is called the buccinator. The buccinator here is a deep muscle in your cheek. It lines your cheek, and if you look at the direction of the fibers, you can see it runs transversely across the cheek. So when this muscle contracts, it actually sort of pulls in your cheeks like you're making a fish face or puckering up your lips, squeezing your cheeks in. So the origin of this muscle is on the maxilla and the mandible, and then it's going to insert onto the orbicularis oris. So that's a muscle. So it's going to originate back here. It's going to go forward and it inserts onto this muscle, which is called the orbicularis oris, and it helps to compress the cheeks, right? Buccinator is actually a muscle that is named after a trumpet player, excuse me. So you can see the fibers here as well. A buccinator is a trumpet player, so trumpet players would have to make a lot of compression in their mouth to blow, to sort of play the trumpet, right? So this muscle plays a very good role in compressing the cheeks. All right, the next muscle in the list is called the corrugator supercilii. So if we go to this picture, we can see the corrugator supercilii here and here. So these are the muscles that are going to be on your superciliary arch, which is where it gets its name. So the origin is a superciliary arch and inserts onto the skin of the eyebrows, and it depresses, or I should say it pulls the skin inferiorly and medially of your eyebrows. So what it does, these two muscles, if you pull them in, what happens here is the skin, your eyebrows go down, right, and in, and the skin here will wrinkle and it makes those two little lines that go down like this, these number 11s they call them, these lines in the middle of your in your nose, in this sort of glabella region. Okay, so that's your corrugator supercilii. So also make a note that not all of our models have this muscle, and this muscle is a little bit, it's shown here, but really it's deeper. It should be deeper to this frontalis muscle. And I think they drew it above it just to show you that there is the muscle there. So that's corrugator supercilii. The next muscle is the depressor anguli oris. So let's find that. The depressor anguli oris. So this is a very descriptive name. The depressor, it depresses, right? So it's going to pull down the angle of the mouth. So oris refers to your mouth. Anguli is the angle here, or the corner of your mouth. So this muscle, if you look at the origin, it originates on the mandible, and it will insert onto the angle of the mouth and then pull down your angle of the mouth so you look sad, or a look of disgust maybe if you pull that down. All right, the next one is the levator labii superioris. Oh, I'm sorry, the depressor labii inferioris. So the depressor labii inferioris is also going to depress the lower lip. So that's literally what the muscle name means. Depressor, labii is lip, inferioris just means it's the lower lip. So you can see that this muscle also originates on the mandible. It's going to go up to sort of the body or the middle of your lower lip, and it's going to depress it. So it's going to pull it down. The next one on your lip is the levator labii superioris. So this is the opposite muscle. It's going to elevate. So levator means to elevate the upper lip, labii superioris. This muscle looks kind of like it's going to your eye, and it has two pieces to it. So it has this larger piece here that you can see, and then in here in this corner this is also levator labii superioris. So the origin is the maxilla and the zygomatic bone. So remember, your maxilla is going to be this bone here with your upper jaw, and the zygomatic bone is a little further out your cheek area. So this, it has sort of a broader origin, and the insertion, I'm sorry, the origin's here. Then the insertion is going to go down to your lip, and it's going to elevate your upper lip. All right, the next muscle is called the levator palpebrae superioris, which is now in the eye. So this has also a complicated name, but just very descriptive. So levator means to elevate, palpebrae means eyelid, and superioris just says it's your upper eyelid. So this will elevate your upper eyelid. So let's look at the muscle. So it's going to be inside your orbit, okay? Because it's inside your orbit, this is not a muscle that you'll see on models. It's only going to be a muscle that you'll see in a diagram. And you can see it originates back here in your sphenoid bone. It's going to come up, and it's, sorry, this one here. It's going to come up, and it's going to not insert onto the eye, but actually go and insert onto your upper eyelid here. So it's going to retract or elevate your upper eyelid. So anytime you open your eyes, you know, the first muscle you contract in the morning when you open your eyes is going to be this one. Your lower eyelid doesn't have any muscles going to it, so it just sits there. So the only one that you can control to open and close your eyes would be this, your upper eyelid. All right, let's move on to your mentalis muscle. So the mentalis muscle, the mental region, of course, is your chin. So this is your two little mentalis muscles here. They're going to originate on your mandible, and they're going to insert onto the skin right here on your chin. When you can wrinkle this muscle, you use it to pout. It's called the pouting muscle. So if you look at the actions, it's to elevate, evert, and protrude your lower lip. So just think about a little kid pouting, and they're going to stick out their lower lip, and they're going to wrinkle their chin and make little dimples in their chin. That's what this muscle does. Okay, so let's take another look at mentalis. So mentalis is right here. Nasalis. Nasalis is very descriptive. It's right on the nose, on the bridge of the nose. And you don't need to know the origin insertion, but it's going to compress. So here's another nice look at nasal. It's going to compress the bridge of your nose. So kind of if you smell something bad, you might compress the bridge of your nose, and it also will help to elevate the corners of your nostrils here. Next one on the list is orbicularis oculi. So this is orbicularis oculi. So the word orb, right, means round sphere. So orbicularis is a round muscle that is around your eye, oculis for eye. You have another round muscle, if we can just jump to that. This is your orbicularis oris. So we have two nice round muscles of the face. For the oculi, the origin is the maxilla and the frontal bone. It inserts onto your skin of your eyelids, and it can close or blink. So this is a broad muscle. If you look at the outer ridges, these outer fibers would engage if you squeeze your eyes shut, but the inner fibers here would be active and blinking. So you don't need to engage the whole muscle at all times. You can just blink using the inner fibers, but you can really squeeze your eyes closed, engaging these outer fibers. Orbicularis oris, same thing. When this one contracts, it's going to squeeze down on the circle, so it's going to pucker your lips, compress and purse your lips, right? Moving on to the procerus. The procerus muscle is going to be right here on the meeting between the nasal bone and the frontal bone. It's not clearly defined in this picture here, but it's going to aid your corrugator supercilii. So if you look at the actions of procerus, it changes position and shape of the nostrils, draws medial angle of your eyebrows inferiorly. So that last action is going to help or be a synergist of your corrugator supercilii. The next muscle on the list, risorius. So let's find risorius. Risorius is going to be a thin muscle that also runs transversely on the cheek, but this is not to be confused with buccinator because buccinator is broad and it's deep, whereas risorius is thinner and it's superficial. It inserts onto the angle of the mouth and it draws back. So if this origin stays still and the insertion moves towards the origin, the angle of your mouth or the corner of your mouth pulls back laterally. So this isn't, you use risorius in a smile. Of course, your corner of your mouth does go back, but it doesn't go up. So this is kind of like a fake smile. If you just draw the corners of your back laterally, it doesn't really look happy. In order to look happy, you have to use your zygomaticus major, which is going to be this muscle up here. So now you can see they're going to lift the angle of your mouth. So this is a great muscle because both major and minor, because zygomaticus tells you that the origin is your zygomatic bone, and the zygomaticus major inserts onto the angle of mouth, whereas zygomaticus minor, you can see, doesn't quite go to the corner, it goes to the upper lip, so it inserts there. But both of these guys will be engaged. This one's really going to be the one for smiling, right? You're going to use zygomaticus major to elevate the upper lip and laterally retract the angle of mouth. So elevate and both laterally retract. So those are those two muscles in smiling. All right. So here's another view of all the muscles we talked about. This is zygomaticus major and minor. It's levator labii superioris, and we have our three muscles on the mandible and the chin. And then I just have some fun slides here. So what muscle is contracting? So this guy is raising his eyebrows, right? So we have to have a muscle that's going to have fibers going up and down. The origin is going to stay still, and the insertion is going to be raised. So if you said this is the frontalis muscle, you're correct. You can also say it's the frontal belly of the epicranius. This one's a fun face. Lots of stuff going on here. So we have these number 11s. Remember I was talking about how your eyebrows can squeeze in and down, and then these wrinkles appear. So this is going to be a job of the corrugator supercilii. The eyes squeezing shut like they are doing, this is your orbicularis oculi, right? You also have a little bit of action here on the nose. So I'm procerus, which aids your corrugator, is also engaged, and maybe a little bit of a nasalis. So what's going on here in her cheek is going to be definitely compression of those cheeks, right? So that's going to be your buccinator muscle. And she's also really compressing her lips. So this is going to be the orbicularis, right? That circular muscle that when it contracts is going to purse your lips. It's orbicularis oris. Okay. Jack Nicholson is also creating those lines, those horizontal lines of the forehead because he's raising his eyebrows. That's frontalis. He's smiling, sort of a creepy smile, but you're going to have zygomaticus major and minor here. And then, yeah, so, and also risorius to retract. And last one, I'm running out of time, but you guys can probably guess a little bit what's going on here.